Kidney disease, as we understand, is loss of kidney function. It can happen suddenly over a matter of few hours to days, when we call it as acute kidney injury. And more commonly, what we are concerned about is the slow progressive loss of kidney function, which usually happens over a month to years period. And that is what is termed as chronic kidney disease. And that's where generally the focus has been over the years, how to detect them early and how to treat them. Chronic kidney disease in India, diabetes and hypertension, high blood pressure, are the commonest causes for chronic kidney disease. And as we know that India is the diabetes capital of the world, and about 20 to 25% of diabetics are likely to develop chronic kidney disease over a period of 5 to 10 to 15 years. So we have diabetes as the leading cause of chronic kidney disease, followed by high blood pressure. Lesser common causes are kidney stones, or some congenital diseases which are inherited at the time of birth, or sometimes kidney tumors. Unfortunately, kidney disease is a silent killer. It does not produce symptoms till the very late stage, and about 7 out of 10 kidney patients first see a kidney doctor when they are in their end stage of kidney disease. Subtle signs of kidney disease are progressive loss of appetite, weight, weakness, lethargy, easy fatigability, and later on the patients will develop symptoms of swelling, breathlessness, and finally vomitings, and when they have the terminal complications of kidney disease. Now, acute kidney injury happens in a very specific setting, like patients who have low blood pressure or infections and are usually admitted in a sick condition in the hospital. So they are picked up at the right time, and the treatment of the cause is the treatment of kidney failure. Chronic kidney disease, on the other hand, is to be picked up early when there are no symptoms, and that is where looking at high-risk population comes into effect. Now, people with high blood pressure or family history of kidney disease, people with diabetes, they need to be regularly screened for development of kidney disease, and simple tests like urine examination for protein, checking the blood pressures, and a blood test to look at the creatinine or the kidney function can very easily detect these patients in their early stages. Additionally, an ultrasound can add a lot of value if it is available. So when we talk about the treatment of these diseases, when the patients are picked up early, we can initiate measures which can slow down the progression. And here, when we talk about slowing down the progression, we are looking at very tight control of high blood pressure with appropriate medications, very tight control of blood sugars with medications or insulin as required, avoiding medications which are bad for the kidney or toxic, like the regular painkillers, which are very easily available over the counter and are very easily consumed by all of us. And later on, as the kidney disease progresses and reaches the end stage, that is where you need a kidney support in the form of kidney replacement therapy. Now, broadly speaking, there are two modalities of kidney replacement. One is called dialysis and the other is kidney transplant. Now, dialysis, what we understand, is purification of the blood. That is what is the usual function of kidneys. So herein the patients visit the hospital about 3 days of a week, and each session is carried out over a period of 4 hours. The blood gets purified of all the toxins and extra water, and the patient is able to carry out their routine activities otherwise. A better modality of kidney replacement is a kidney transplant, wherein a healthy person, who is usually a blood relative and is medically fit, donates one of the two kidneys, which one kidney is transplanted into the patient by way of a surgery, and he is thereafter able to lead a normal life. There is no need of dialysis or regular visits to the hospital, and they need to consume a certain degree of medications to keep their immune system in check so that the kidney's acceptability remains good. Apart from that, they can lead a normal life, a normal healthy lifestyle, and they can go back to work. Small children who have been transplanted can go back to school, complete their college studies, they can get a job, they can marry and have children, and lead a normal life like anybody else, which is not very easily possible for those who are on dialysis. So when we talk about the cost of treatment in our settings, dialysis is more expensive than transplant because we are talking about long-term treatment of kidney failure. So when we talk about treatment, we're talking about 5-10 years of treatment. And yearly cost of transplant over a period of 5 to 10 years of dialysis outweighs that of transplant multiple times. So broadly speaking, if a patient spends about 5 lakh of rupees on dialysis a year, in transplant we can take those 5 lakhs and do a transplant, and thereafter they spend roughly 1 lakh per year. So it's most cost effective treatment of kidney failure as well. Since these are diseases which have high cost implications for treatment, it makes sense to pick them up early and have adequate preventive measures. So as we said, regular screening for high blood pressure and sugar should be done. Lifestyle changes, because lifestyle is a big factor in development of high blood pressure as well as diabetes. So leading a healthy lifestyle, keeping your weight in check, keeping your blood salt intake in a moderate manner, about 3 to 4 grams per day, and good intake of fluids. Avoid regular intake of painkillers over the counter because they damage the kidneys, and get yourself regularly screened for presence of kidney disease.